of 2 more cases of coronavirus in Kenya, which brought the number of those who are tested positive to 3. We have suspended all flights effective midnight 25th March 2020. Therefore, we now have in the country 7 confirmed cases. I think it is important for us to recognize the global nature. A lot of people did not actually believe it, but the figures that we have continued to show have clearly established that coronavirus is here with us in Kenya. Kenyans must treat this matter with the seriousness it deserves. All the 156 samples have tested negative. As a government, we are continuously improving our level of response. Why create a problem for the police, as in they have to arrest you, they don't have to arrest you? It is compulsory self-quarantine, so to speak. That some have decided to make fun and brand our effort as a PR exercise. Really?
Now, the tragic human toll in Kenya is 3, and by the end of this month, coronavirus cases in Kenya will hit 10,000 mark. This is the cautious, upbeat assessment from the Director General at the Ministry of Health, Dr. Patrick Amor, who is also at the heart of the battle against the coronavirus pandemic, and also warns of much tougher days ahead with no time frame for the lifting of the curfew to ease restrictions on people. Moreover, the grim picture painted by the government is that cases of the pandemic will exponentially rise in the country. But this is a matter of deep sensitivity for the government in the midst of a calamity. Is the government of Kenya signaling to Kenyans the scale of the crisis? And is the medical response accurately well targeted at the less well-off and the vulnerable? Be part of the discussion in the next 30 minutes. The hashtag on Twitter is News Compass, and we are joining live. We are joined live by Professor Julius Oyugi, who is the Professor of Virology at the Department of Medical Microbiology and Deputy Director at the Institute of Tropical and Infectious Diseases at the University of Nairobi. Good evening, Professor. Listening at the assessment given by Dr. Patrick Amor, the Director General at the Ministry of Health, is this an accurate assessment of the situation? And in your view, perhaps a case of more or less the tentative signs of hope that the government is trying to instill in Kenyans? And what is the direction of travel of the response so far by the government?
Thank you very much, Ayub. And so the government, in terms of what the government has done so far and whether they have done, what we could consider as adequate in response to COVID-19, I think they have done very well so far for the following reasons. Number one is that today, all Kenyans are informed on the new cases of COVID in this country. So every day when the people watch TV and the government gives updates of those who are infected and where they are, is a good sign that people are getting informed. That is one thing. Mm-hmm. Number two, you have also heard the government talking about expanding isolation facilities across the country. So they have expanded these to almost all counties now. That's a good thing. The other thing that they have done also is to increase the number of testing. At the beginning, we were only having 2 sites, testing for COVID-19, mm-hmm. but now this has expanded, and you have seen the number of people who are being tested rising from, as at today, they were testing up to 600 cases. So these are good things that are happening, and I think the government is in the right direction in terms of fighting COVID-19.
All right, well noted point, but perhaps let's talk about the most critical resource here that the government has wasted from the onset, which is trust. And from the landing of the Chinese flight, the disembarking of the 239 passengers on board, the sharing of the video by a Kenyan who was later branded or charges of terrorism brought against him. I mean, does it again perhaps bring to forth or lay bare the aspect of inconsistencies in terms of packaging of the message and the information by the government? And how will the public trust already situations that the government has lied before in the case of the drought in Turkana County, which killed Kenyans, and the government said no Kenyans died?
I think the way government works, there are so many experts within the government, especially from the Ministry of Health. And so when you hear the government coming on board on TV to give information, the information actually coming all the way from the experts. So I think Kenyans should trust what the government is telling them. And I think the direction the government has taken so far, in my thinking, is the right direction in terms of fighting this pandemic that has now come to almost all countries in the world. So I believe that the information they are passing around is accurate and is based on very well thought ideas from experts.
All right, well noted point. But talking about the aspect of now the healthcare systems coping up and not becoming overwhelmed, inundated and overstretched in the cases of Italy, Spain, Belgium, Japan, the United States of America. What is the assurity point here and the guarantee that the government can give to ensure that what they are tackling at the moment does not burden the already ailing healthcare system in the country and the infrastructure?
So if you look at like 2 days ago when the government was giving a report of the status of COVID-19, they talked about certain numbers, like they were saying that by the end of this month, we may actually, if we don't follow the guidelines that they're telling us to follow, we may actually see about 10,000 cases of COVID in this country. Those numbers are based on mathematical modeling of COVID-19, and we need to believe the government. If we don't follow the current measures to prevent the spread of this disease, as the government says, there's a possibility that very many Kenyans will be infected by the end of this month. So I think if that happens, it may be catastrophic, because if we have 10,000 Kenyans infected by end of May, about 20% of them will require to be hospitalized. And of those 10,000, about 5% will require ICU facility. And that may not actually be able to take care of those numbers as it is currently.
All right. Talking of the healthcare capacity and perhaps the fears that the continuing cases that are climbing up, or the exponential growth, will saturate the healthcare system in the country. Did the government not archive lessons perhaps from the Ebola outbreak in West Africa in 2014, where we sent, a group of healthcare workers to go help those countries out, and then when they came back, do you mean that the government has never archived any lessons that we might lay down today to at least save our healthcare systems from being overburdened?
So I think when you talk about lesson learned from the Ebola outbreak in West Africa, the Ebola outbreak in West Africa, what we learned from that is that the Ebola was able to spread and infect so many people because of their very weak health systems then. And that is why, the whole world, was mobilized to go to West Africa to help West African countries which were, struggling with Ebola at that time, to help it, bring it to a stop, the spread to a stop. However, this virus, COVID-19, is slightly different from Ebola in terms of the way it is transmitted. And, you cannot really use the lessons from the Ebola outbreak in West Africa to kind of fight this current disease. If you look across the globe as we speak now, almost all countries, including US, some of those, Italy, these are countries which are developed countries. They're struggling with the same disease the way we're struggling with COVID-19 in this country. And in my understanding is that the government of Kenya has done very well so far. Remember, since we saw the first case of COVID-19 in this country, majority of the people who have been tested and confirmed positive were mainly imported cases, people who came from other countries to Kenya. It's only a few days that we started seeing community spread, which means that as soon as the government noticed that this thing was coming to this country, they kind of started preparing in terms of surveillance. And immediately, remember, people were traveling into this country. They were being screened at the airport. Those whose temperatures were showing that they had fever were being isolated. And for that reason, we started actually filtering out people who are infected coming from other countries. So to a large extent, the government actually started preparing, but I think the government may not have anticipated that this thing may spread fast and prepare for it, in a way that, we could actually control it. And this is not just unique to Kenya, as I've told you. US, which is one of the superpower in this world, is struggling with COVID as we speak now. So my assessment is that the government has done very well. And as we speak now, you can see it in today's news conference, the government is actually preparing to hire more healthcare workers, which is a good thing in terms of managing the increasing number of people who are testing COVID positive.
All right. Then taking the temperatures of things here, despite painting a form of perhaps a good picture of the government's response so far, what will you say to CS Kagwe's counterpart, James Macharia of Transport, and who said, when he appeared before the bicameral parliament here in Nairobi, that the person who took or shot the video of the Chinese plane landing will be, of course, charges will be pressed against him in a court of law, and that today we have the virus at home, meaning we could do better than where we are at the moment. Doesn't it also take the responsibility, the government I'm talking about, that these cases in their infancy will have been controlled if it were not for incompetency at the Jomo Kenyatta International Airport?
So I don't really believe that we really had incompetencies at the airport per se. And the case that you are citing was just actually one case. If you look at the people who tested positive, so far, majority of them are not from China per se. And therefore, I think that case was just an isolated case. And we should not use it as the only reason why the virus has actually spread in this country today. People have come from other countries, from Italy, from US, from other countries who are positive, who actually we identified them in this country. So I think, that was an isolated case, and I think the government handled it in the best way possible.
But Prof, to just pause you for purposes of accountability and speaking truth to power in this particular case, Kenyans wanting answers, then why will the government shroud in secrecy or planned to shroud in secrecy the landing of that plane and not being as open as other flights were, especially the Chinese flight I'm talking about? Straightforward.
I really don't want to comment on, matters pertaining to what the government, did with that particular plane. I would be very comfortable to respond to matters more of, concerning what we are dealing with in terms of controlling the spread of this virus, Yeah.
The next point is, though, then again, another important perspective with which we need to also unpack it. The healthcare workers who are at the forefront, deployed. Of course, it's more or less like what the French President Emmanuel Macron did say, that we are at war with a virus. I mean, how do we then immune them, from the pandemic, which is a killer virus in the country, and we have heard the complaints by the clinicians and other workers across the country who have raised concerns about their welfare and, of course, them contracting the deadly virus. What is the specific, specialty treatment that we need to handle them with in the fight against the coronavirus pandemic?
So for the healthcare workers, I think maybe the public may not know, a lot has been going on, especially in terms of training the healthcare workers. Mm-hmm. One of the best tools of fighting a disease is to, inform people on how to protect themselves. So there is an ongoing training among healthcare workers in this country. And, with the training, they will be able to handle, patients who are coming to the hospital with COVID cases. The government has also actually, I'm not speaking on behalf of the government, but I believe that the government has put in measures to provide all the healthcare workers with protective, gear, like gloves, masks, so that they can protect themselves should they come in contact with, people who are positive with COVID-19 virus. So I think the government is aware that these are, individuals who are at risk of acquiring this virus, and a lot has been put in place in terms of training as well as providing them with the protective gear to protect them from acquiring this virus.
Okay, then for purposes of continuity, and we are in the midst of the calamity here, and equally are paying attention to the coronavirus pandemic, but how do we then universally equally turn our attention on the other, of course, cases of diseases in the country, for instance, measles, respiratory infections, and other illnesses, even as we battle or seek to end the coronavirus pandemic?
So I think what has now happened is that almost everybody has moved to, concentrate in fighting coronavirus because it's a pandemic, it's a new disease, and we really don't know how to deal with it. We are learning how to deal with it as it is, infecting people day in, day out. And the rate at which it is infecting people is worrying and alarming, and therefore it is actually good to, find ways of dealing with it now before it spreads and kill a lot of people. Having said that, I think, the other diseases, if you talk about measles, the vaccinations is going on for, kids who require these vaccines, people who have malaria are being treated every day for malaria. Those are the, health activities are ongoing. The only reason why you may think that, those other medical activities are not going on is because every news item, social media, everyone is talking about COVID. It doesn't mean that the health system has shut down and we are only now focusing on COVID. The health system is still working the way it used to work, except that now there is a lot more concentration on COVID because it is a new disease.
Okay, again, the important element of what we need to do will be our endpoint of this discussion. But given the spread of the virus, starting off in the city of Wuhan in Hubei province in China, later to the regions like in Lombardy in Italy, and then to London in the UK, then you have cases in New York in the United States of America. Did Africa and Kenya in this particular context had a headroom, a sort of wiggle room to try prepare up for the virus? I mean, coming up with preventive mechanisms. Yes, it's at home, but equally, is it an opportunity for the African continent, more or less a disguise in blessing, that come at a time when the continent and Kenya need to stand up and develop a vaccine for that matter and help the global community in coming up with a vaccine to contain the coronavirus pandemic?
Yeah, so the coming of COVID-19 is going to actually have an impact, long-term impact on many countries with regards to health systems and health facilities and healthcare systems in these countries. At the end of this pandemic, I think many countries will look at their health systems, whether the health systems are able to manage the next pandemic. There's always going to be the next pandemic, which will occur, you never know, 5 years or 10 years from now. And I think what we have learned from the COVID-19 is that countries which have weak health systems may be struggling to deal with COVID-19 compared to countries which have very well developed health systems. So this would be a good lesson for many countries to learn. The second thing that I wanted to say, during this outbreak, remember one of the bottlenecks in controlling the spread of this disease was developing testing kits for this virus.
Okay.
In Africa, as we speak now, it's only Senegal which has got the capability to develop the testing kit for COVID. And there's demand for every country to test people who are suspected to be having COVID. So moving forward, I think most countries will look at putting in facilities for, developing kits wherever there's an outbreak of a new disease within a short time to help them test and identify such persons. I think there's several things that many countries will have to look into. The second thing is about, the health systems. Remember, the government started talking about universal health coverage. I think this is after this COVID pandemic, we will really need to relook at how do we actually implement universal health coverage to make sure that all health facilities in all counties are empowered or have the ability to test and detect and manage patients should there be another pandemic in future.
All right, as you mentioned out, it's inevitable. Pandemics will come, and of course the modern day globe has equal experience. The Spanish influenza 1918-19, the swine flu of 2009 here to stay, and then you have in future pandemics that will come. They are inevitable. Then how do we restructure our healthcare systems in the country, perhaps achieve one main item which features in President Uhuru Kenyatta's Big Four, which is universal healthcare coverage for Kenyan Stroke says accessible, affordable, universal healthcare coverage in the country? And is that attainable in the mathematical years that are remaining in President Uhuru Kenyatta's tenure?
So it may not be attainable in the remaining years of President Uhuru Kenyatta, but I think it had started, and I think we need to move it to the next level. Slowly by slowly start developing. Move beyond piloting, which the government has started doing, to now implementing it to all counties, and come up with standards. We should, in this country, in my thinking, if we want to prepare for the next pandemic, each county should have health facilities that can manage, patients within that county, should there be an outbreak of a disease like COVID come in future, without now referring these patients to other counties or even testing to other counties. We should have minimum standards, and this should include, number one, the type of hospitals that we have. We should actually, have certain number of beds at a certain level of health facility in these counties. We should also have, testing facilities which have capability of, testing all known and new diseases which may emerge in future. The other thing is about healthcare workers. You can see we are now trying to employ more healthcare workers in a pandemic. This is because we may be overwhelmed by the number of patients who are going to show up in the hospital because of this COVID. But I think we need to rethink of how do we, have more healthcare workers in our hospitals, number one. Number two, how do we ensure that we provide them with the necessary equipment for them to perform their work, so that, our health system, if you go to a public health facility, you get the kind of treatment that you get if you were to go to a private health facility. So we really need to relook at our health systems per se in future.
Okay, Professor Julius Oyugi, thank you for joining us from here in Nairobi County through Skype, of course, to talk about the issues that are of importance and to Kenyans with regards to the coronavirus pandemic and what needs to be done by the government. And so far, questions onto the medical response on what's deployed by the government. He is Professor Virologist at the Department of Medical Microbiology and the Deputy Director at the Institute of Tropical and Infectious Diseases at the University of Nairobi. Thank you so much. We appreciate your time to sample some of your feedback here on the program and take a look at what you're saying on Twitter. There is a concerned Kenyan who says, Kenyans should be encouraged to be kind to each other during these perilous times. Hard times, talking about, of course, the curfew and the pandemic, which continues to havoc many parts of the world. And here, Wycliffe says that COVID-19 or the coronavirus pandemic has exposed our politicians. 2022 will be the end of some political careers, talking about, of course, the resounding silence from members of the political class in the country. Kenyan says, what happens next when this is all over? I mean, the restarting of the Kenyan economy in what appears to be a gloomy economic prospect in terms of the GDP growth across the world. And, of course, as Kenya seeks some help from the World Bank and the International Monetary Fund. Thank you for joining us here on the program. We'll see you next week here on News Compass. Good night.